not only that, no, but in women health. And it's such a privilege to have her say or be educated or breast cancer. So said how we can stay away and assist even put a biosecurity a bit to me boy who by and say prevent yourself from say being breast cancer. It's such a privilege to introduce to us Dr. Abena Adai. It is Dr. Mepachos, why you ready? Welcome to Toronto Seventh-day Adventist Church.
Now, and this health is and why we talk about breast cancers. A lot of things can happen to the breast, and it's not everything that is cancerous. So among the young people, a lot can happen. There are what we call risk factors. You can't ask me what causes breast cancer. We don't know yet. So that's one question I cannot answer. So apart from that, there are a lot of things that can happen to the breast. We'll start by talking about what a normal breast looks like. So the body is asymmetrical. If we go halfway into the body, we just have a line through our body. The two halves are not the same. The same way, if you buy a new shoe and you wear the two pairs, one leg will be a bit tighter because one leg is slightly bigger. It's the same with the breast. We have what we call your dominant breast. You need to know one breast is slightly bigger than the other one, just a little bit. With every part of half of the body is not the same. So that's one thing about breast. A normal thing is one is slightly, guys. Okay. Then another thing with normal breast, there is no lump in a normal breast. Sometimes the older generation will tell us the breast comes with a lump. It's not true. There should be no lump in your breast. So things that happen to the breast, a lot of things happen. There can be liquid coming out of your nipple. If you are not pregnant or breastfeeding, there should be nothing coming out of your nipple. So that's something that can happen to the breast. It doesn't mean you have cancer. There can be a lump in your breast. Not all lumps are cancerous. That's another thing. Once you see a lump, it doesn't mean you have cancer. That's something else that can happen and it's not a cancer. There is abscess. An abscess is there'll be liquid that will form in the breast and it's an infection. It's very painful. Again, it's not cancer. So a lot of things happen to the breast. We talk about breast cancer a lot because that's what kills the woman. Na me church mu say nufuo mienu no baako so kakra bi echen baako. Nti a wase wo di two trim say mimi nufuo no ebia nifa ne so ana benkum ne so. Te sese ne auto mpaboa mu na o hye a mpaboa no onan baako be chill kakra. Onan mienu no enye the same. Indeed, that's how nufuo ni mienu nenso enye equal pepe sa. Inti also the two trim. Meme die no nifa neso ana benkum neso kakra. Inti se bibi mposi na se benkum no first eno na eye wo dominant en neso kakra. Next start ye ketwa. Wadwen beba so se minifa na ye kese sen mi benkum ti. E wase wo hwehwem adan. Enye bibi e betu nufuo no ene cancer. Ana se kokram enye bibia beka nufuo no nneoma bebre timika nufuo ena nneoma etimika nufuo no enye se ebia edwa betom keke yewo ebia ensuo timi free chirwa no ba se wonyo ba wuni nsan ana se uni abofra ketua onumwa ewosi nufuo no eye dry hwi umia ano ne kakra bia enyi se nsuo bia free mu ba. Inti bibi selsia entrese wo cancer but nyoma bebrate me tu nufuo no ti agese all the hospital me ahwe aden enti na eni sense obi afri mu ba na ensuo free mu ba. Yes, sorry I can breast cancer ho asem if we say eno enetimi ku oba no inti wiase afena nyina breast cancer no ne number 1 cancer e wo mba mu. So What is breast cancer? We don't know the cause of breast cancer, but we know that it is just uncontrolled growth of cells. So normally the cells go through a cycle. They grow, they perform their functions, and they will die off. But when there is cancer, there is no control over the cells, so they just keep growing. So that's what breast cancer is. Unfortunately, we don't know what causes it. So I can't tell you, don't do this if you don't want to get breast cancer. We know what causes malaria, a bite from a female Anopheles mosquito. So we say, okay, spray your rooms, you can put the mosquito cream. If you prevent the bites, you won't get malaria. We can't do that in the case of breast cancer. So that's the problem. Kokrameto nufo nimno. And no, a trese nufo no. Cells ni nia honam na ntimi en check your inti cells ni benyin sa na omo eye ne omo pe inti eno ne kokrameto nufuom yenim adekorapote de kokram ne ba inti yentimi nsi ano kwan se oba we so ye we ya ene de kokram beba anase we we ya ebesi ebe protective so we ya na we ya unya kokram obia betimi enya bi enso omu sanfom a 99 ebeye ma emu ba akope ene bia bebe ma. So men also get breast cancer, but they are in the minority. So if we pick 100 breast cancer patients, 99 of them will be women. Only 1% will be a man. So that's why most of the time we talk about breast cancer and we talk about women, because that's the norm. But men can get breast cancer too. So we don't know the cause, but we know about things that can increase your risk. So we group them into two: modifiable risk factors and non-modifiable risk factors. So modifiable risk factors are things you can change about yourself to reduce your risk of getting breast cancer. Non-modifiable risk factors, you can't change them. So the most important risk factor to getting breast cancer is being a woman. Every woman is at risk. 1 in 8 women. So if there are 8 women in any room, there's a possibility that one of them can get breast cancer in her lifetime. 1 in every 8. That's how common it is. The second thing is growing older. So the older a woman gets, the higher her chances of getting breast cancer. So breast cancer is more common in the older women. We started educating younger women because, 1, we hope to hit 2 generational points. We hope you guys will educate your mothers, your aunties, even your grandmothers. And then we hope in the future, your children, especially the girls, will also get educated. So there is this cycle of ignorance going around. If the girl is not educated and she gets a lump or something happens, she'll ask her mother. If the mother doesn't know, it means the cycle just goes on. The mother will tell her it's nothing, or take this, take that. Then there is no education going on. So we decided, instead of just targeting the older women that breast cancer is common with them, we will start educating the girls. Also, age does not exempt breast cancer. The youngest person we've had diagnosed with breast cancer was a 13-year-old, 13. So it was a teenager. So once the breasts are there, they can get breast cancer regardless of your age. But the older you get, the higher your risk. So these 2 things are the most important risk factors we are going to talk about. It doesn't mean that if someone doesn't have any risk factors, she can't get breast cancer. once you're a woman, you can get it. So even if everything I talk about now, you are in the good side of it, you're a woman, you still have the risk, you can get it. Somebody else can also tick all the boxes, like all the risk factors, and they will not get breast cancer. So there is also chance or luck attached to this. So these things are just to educate you that what you can change, you change. But it is not 100%. If you do this, you won't get it. That is not allowed. Every woman is at risk. So every woman has to be educated and every woman has to screen. You need your own screening routine. And see, me babe church and nyoma mu kakra se ebia ti bi ebi o nyoma we mu a ukomu a ebema o risk se obenya breast cancer no akosro. And just say me can be wo ha na wo wunni bia and just wuntimi nya cancer ni bi. Oyo bank one dia ubetimi se nufo ne wo ho a ebetimi ayare. Enti oba bia betimi enya breast cancer. Oba no the more onyi no na ne risk kosro. And stress emma bunun 20s 18 19 and stress omu de omuntimi nya bi ana 30s and stress omuntimi nya bi, but more common emma omanyi mu. Inti nipa osakra yehu si wenya breast cancer no edi 13 dumiensa. Inti so far as nufo ne wo honko ade ebetimi ayare. Non-modifiable risk factors. Age. The older you get, the higher your risk. Your sex. If you're a female or a male, females are more at risk. We call something nulliparity. It means a woman who has never had children. That's nulliparity. We have women who had their first child when they were over the age of 33, 34, 35, they increased their risk a little by having their first child at that later age. Then we have hereditary.
I can hear you.
Hello. Then we have hereditary. If the woman comes from a family that has had breast cancer before, so in the family, maybe her grandmother, her mom, her sister, her female cousin, there has been a breast cancer diagnosis in the family before, then it also increases her risk that she can also get it. So we advise that once there is a diagnosis in the family, the person diagnosed, if they don't mind, should let the women in the family know so that they educate themselves and they'll be on a higher edge, like I need to screen myself. They'll be more serious with their screening. I talked about not everything that happens to the breast is cancer, but there are certain things that happen to the breast that can increase your risk of getting breast cancer. So if someone has had a lump in the breast before, we took out the lump during surgery, we said it's not cancer. They can get a lump again, maybe 5 years down the line, 2 years, 10 years. That second lump that comes, there is a higher risk that it is cancerous because you've had a lump that wasn't cancer before. So the fact that you had a cancer, a lump that is not cancer, it actually increases your risk that the next one can be. But in practice, most of the people that have multiple lumps, maybe someone has had 2 or 3 lumps, it was not cancer. They rather relax. And then if a lump comes again, they'll say, oh, me dear, I get it all the time. It's not cancer. But in actual fact, maybe this time it actually is cancer and there is a problem. And then we call something long menarche. It's when you start menstruating before 11 years old. So you started having your menses earlier than normal, earlier than 11. Then you also had menopause after 55 years, a late menopause. So because you've had the longer stretch of having your menses, your risk is increased. So if you start menstruating early and you stop menstruating late, you have an increased risk. And then there is genetic mutation. There is a gene that we have found, it's called BRCA1 and BRCA2, breast cancer gene. So if a woman has that gene, there is a very high percentage that she will get breast cancer. So I don't know if some of you heard, there was a Hollywood star who took out both her breasts and then put implants because she has that genetic mutation. So there is a high risk. Leaving the breast means she can get breast cancer. She didn't want to deal with that, so she took them out. So that genetic mutation. So these are things you can't change. You can't change the fact that you're a woman. You can't change the fact that you are growing older every year. Your family history, if someone in your family gets it, you can't change it. So all these things, and then having your first child, some people, it's not by choice, but they can't have kids early or as they want. So all these things will increase your risk. But again, just the fact that your risk is increased does not mean you must get breast cancer. It's just so you know, I have an increased risk, so I need to be more proactive about screening. And see, and your it bets me a sia won't mean sano. And it's a or your bar. The fact so your bar or risk na costro. Uni mano unia na or risk and so costro so ubets me enya breast cancer. Or bar one would die. Inti ebia enye ne pekra se onwo wantimi anwo eno nso risk because ro kakra oba owo ne ba ne first child no edi 33 34 35 eko inti wunyi sana ansa na wo wabakan a risk ekosro me di kan ka se enye bibia betunufo no na ye cancer. Inti nyoma na etimi tunufo a enye cancer no ebitimi ema risk ne nso kosro obi wakwa adwa beto ne nufo nim ye beyi dwa na free ho ye behwe ye beka se adwa na enye cancer ebia 5 years 2 years 10 years adwa foforo betimi abeto nufo nim enti the fact say adwa bi beto omu dada enye cancer no risk ekosro se adwa we ya asan ba no enu betimi ay cancer. Inti normally nya yenye hu wo hospital ni says obi wo hwana ebia wenya dwa 1 wenya 2 ni nyina ye ka se nya cancer emma ono relax say oh me de minya dwa enye cancer, but I was say the opposite. Said dwa foforo bi betoma ntentem so ano akọ hospital because o risk no kosro say ebia dwa eba ye de cancer. Another thing ni say obi ohwa na busuam cancer na bahoda ne maame ne nua ne cousins inti se busua nim cancer pie hoda ye tai catch rom se catch ma na we busua nim ne se wo anya bi sano na omahu se wase me da me ho so because me risk kosro ebi aba ma busua mu da enna se o start bunsa especially mana mumwenyi no munim da muchi monsa munim da munya menopause dada inti se onya menopause no we 55 years num ekwa and I will start say you know na we less than 11 years do back or risk kosro because menstruations bebre a chain and man or makano. So 11 and 55. If o starting term a chain 11 years and na ujai on sabu na with the 55 ekwa or risk ekosro kakra. There were genetic mutation and so and no ye and saye ba mujanim enti no se obi wobia ne chance ne kosro pass obetimi anya breast cancer. Inti nyoma amabobosui untimi nsesa no obi wo ho anya ne pese onwo enti anase oyoba wuntimi nsesa enti se nyoma we nyina bi efo obi ho a eno nso nkyerɛ sɛ kyenkyena akye e wo so onya breast cancer obi betimi ai we mu nyina owo mu nso onya bi ade a yahwɛ a yehu sɛ e protect oba no free breast cancer breastfeeding se owa ye encourage se e wose uma akwala ni num eno boa akwala no esanso boa maame no. So one thing that we know that protects a woman from breast cancer, lowers the risk, is breastfeeding. So with the young ladies, if you have kids in the future or now, we encourage you to breastfeed. It's protective. That's the only type of breastfeeding or sucking of breast that we know to protect. It doesn't cure and it doesn't cause breast cancer, but it has a protective effect. That's all. Modifiable risk factors are excessive alcohol intake, being overweight, lack of exercise, smoking, unhealthy eating habits. So these are common things. A healthy lifestyle is the same with heart disease, diabetes, most of the other diseases. All these things are not good for them. These are modifiable things you can change. Adopt a healthy lifestyle. There are two more things that we are still doing research into, but we've realized they increase the risk of breast cancer in women, especially Black women, because we do them a lot. So skin bleaching and then perming of your hair. So we are doing research into these two to know the exact components of the creams that causes it. So with time, we'll know the exact things, and then you'll be able to sort out, okay, not to use this brand or this brand, but for now, we can't tell. So what we advise is, if you will be, so with skin bleaching, stay away from it. It's not only breast cancer that is bad for it, skin cancer as well. So skin bleaching, we advise no, it's a no. And with perming of your hair, if you can, you don't. But if you still want to, you need to use quality creams, so that it's not creams that we don't know what they put into it, because we are still doing research to find what exactly is in the creams that is increasing the women's risk for breast cancer. And nyoma ubetimi asesa no ebetimi reduce risk so ubenya breast cancer ono monsa senka ubetimi a no agyae untimi nso agye se wote so bebre smoking cigarettes, shisha is smoking. Wo young people na fe no use can smoking. Lack of exercise. Inti se wedwuma ebi out to hold the bia just all sorry nante kakra. E was who did ye we mu nyina ye nyoma to say diabetes ana akumayare nyina ye catch say enye e was so jai ana what so inti nyoma mienu e ka ho a ye start research ye hu say emboa breast cancer eye emma omukọ ho eno no ye kasi ye njai ena emma omu etwe omuti inti so betimi a enu nso no ode ato nchen kakra untimi nso a cream a de betwunti no make sure say a cream papa nya obetimi akan ebi oho ebi muntimi nkan ne ewo cream nim kra inti sesi a ye research with time ye betimi akase ade we hu wo permin cream nim a menu su. So now need the advice a betimi di amano no. The next thing is signs and symptoms. I don't like talking about signs and symptoms because if you wait for them, it means the cancer has been with you for a long time. So please try to be screening and don't wait to see anything. Breast cancer, most of the time, there is no pain. So one, if you are sitting to wait to feel anything, you may not feel anything and you'll be with the cancer for a long time. Another thing, the most common sign we talk about is a lump in the breast. Again, not all lumps are cancerous, but don't wait to see a lump. If you sit to wait until you can see that, oh, there's a lump in my breast, it would have taken so long for the lump to grow to get that big for you to notice it. So you need to find these things before they show themselves up. There should be no discharge from your nipple. Another sign and symptom, nipple discharge. If you are not pregnant, you are not breastfeeding, your nipple should be dry. There is something we call pure orange. So the skin of an orange, that is a classic late stage breast cancer sign. So there will be a lot of dots around the breast. That's why we call it the skin of the orange. And it's a very late stage sign. The breast can also have an ulcer, like a sore on it. When the cancer stays for too long, there are two things it can do. It can either shrink the breast and eat it off, so that your chest can be flat, or it grows outwards and it will burst into a sore. Dimpling. The dimples that we see in the cheek that we are like, oh, that's nice, that's cute. If you see a dimple on your breast, there is a problem. It means the skin is retracting inward. There is a problem that's pulling your skin towards it. So it will form a dimple there. It's a bad thing. We don't need that. Nipple retraction. So there are some girls that when it's cold, their nipples go inward. Normally the nipple pops out. So you need to know, what is my normal? The nipple should be out. But if you are the type that when you are cold, your nipple goes inward, after taking a warm shower, it will come back out. That's your normal. But if your nipple doesn't retract, and then now you see that it's going flat, or then it starts going inside, there is a problem. There should be no rashes on your areola. There's a specific type of breast cancer. No lump. It's a sore on the areola and the nipple. Paget's disease. Again, that's also late stage. So we tell people, for example, maybe in a month, you see a rash on your nipple or your areola. You apply whatever you apply yourself. It's not going. Antifungal cream, whatever. In a month, 2 months, then it's a problem. You need to go to the hospital. There is something in your axilla, your armpit. So I'll show you how to screen. You need to always screen your armpit. Some women have breast tissue in the armpit. So anything that can happen to the breast, it can happen in the armpit, the tissue there. If you don't have breast tissue in your armpit, we all have what we call lymph nodes. So if there is a problem in the breast, the first place it will start to go is your armpit. So there is a lump in the breast. Maybe you don't even feel the lump, but when you go in your armpits, you feel something there. We need to check you. Maybe the lump is not big enough, but it has already started moving out into your armpit. And then change in the size of your breast. Like I said, if you know my left is my dominant, is the slightly bigger one. When it starts getting smaller, there is a problem. When your smaller one starts getting bigger than your dominant, you know there is a problem. And I said the cancer, it can either be shrinking your breast or it grows out bigger. So either way is a problem. You need to go to the hospital. So you can't sit and tell, is my problem cancer or not? You have to go to the hospital, and don't wait to see the signs. You need a screening routine. You need to be screening. And hospital. but yempese obetena se and atwen se obehu bibi inti mekere mo senia wa obehwehwe onufu mu ene senia wa obenya screening se bia me every year me koha ekoye screening sa no na wo bibi hyase a obehu ne ntem ansa na dekode no adane ehaw se joa beto nufu onima eno ne number one thing na most of the time ye ka but nyoma be brain so timi ba nufu ne ho ensakraye enya drop me can say unyin sen anase akola num a eni se bibi free nufu onimu ba anka ho no sani anka ho dot bebre wono breast cancer ne drew late stage na nufu ne nso timi yesa inti se wo tena se twen se ubehu se onufu no asesa da ne sa e kire se late inti ni se otena se twen se obehu bibi se ekro beto nufu ne ho a e problem to kreda nipa afnu eyefe yekasi nipa we wadem phone efe sa to krono ebi beto nufu ni mu a yempe etresi problem esi wo nufu ni se chirewanu nufu na no se boko mu a e problem nanso ma bi wo ho asa na omote ebi anopo be sori awode no ni nufu chirewan ne be bokom odware wie osiesie ne ho a epie ba eno de ye oba no ne normal but yo oba bi na se onufu no aya embonkom ano chirewan mbonkom a se bokom a ye wo problem ti age so oba hospital hwehwe onufu mu a e wo so oba wa motu emma bebre wo moto ama inti ade ebetimi esi unufu no ebetimi esi moto amanim inti hwehwe nufu onim wi a age so okọ wa motu enso kọ hwehwem se wonni moto ama wo wa motu mu a ye wo bibi a friend lymph nodes obia wo bi se normal a udon sakọ wa motu ma unfilium but problem sinufu onima ebekọ wa motu manimu wa motu first lymph nodes nim inti ebikra nufu no wo behwe no hwenye no enso bibia behye wa motu e so ko hospital ni ehwe adan na bibia behye wa motu enna se nufu no size necessary me ka se e so hu se me bankum ne so kakra esi minifa inti se bankum ne so no e start twen ketwa anasi nifa na eswasin bankum ne start ye kese asin bankum na there is a problem inti breast screening wo near friend of first one breast self examination wo ba no se wo da so echimunsa ye menses new year 2-3 days echino no wa hwehwe onufu nim inti achase every month 2-3 days after your menses obehwehwe onufu nye wo nia obi a ya training no hospital nurse and doctor obehwehwe mu amawo eno nso wo ho eno no ye kase a very short yinti ye kase se ubenyampo a October bi omo ye no free no aya try na every year tobi aya training no hwehwe mu ma no emma se utimi eco hospital mi hwehwe mu ma na ebi a 3 months later ye October na group bia basi ye behwehwe mu a menkase me de me mahwehwe mu 3 months ago ntimi hwehwe still me hwehwe mu ma the more ohwehwe onufu mu no the better for you yourself because the 10 months 11 months until the next October no unim ni esi wom unless you are very serious every month ohwehwe onufu nim nti bibisi a obehu akọ hospital. The next thing is mammogram a x-ray of onufu no nti eno no 40-year-olds and up enfie aduanan eko ena omoye Canada han baby wo ho 50 years but black person there was so ultimately started earlier than 50 no Inti you're 40 years and up, try and get mammogram. Or doctor no, ebi obesha will say every 2 years obey mammogram, and every 1 year obey mammogram. And no denti we your first one na mo set routine. Obia ne routine obey. And with younger girls no, mammogram no any sensitive for omunufu no. Inti omu say ebe ultrasound. Mpenifo ni bi wo okra ye mammogram a ye the ultrasound ne beka. Inti it depende send ya make obia ni routine or type of breast near settle routine amount. So with breast screening, we have monthly breast self-examinations. You do that every month after your menses. 2-3 days after your menses, you need to screen your breast. I'll show you how to do that now. Then we have clinical breast screenings. Someone trained should screen you at least once a year, but it can be often. If you have the opportunity to be screened twice a year, do it. It's not a complex thing. So, and it's not invasive, so you can do it. There are mammograms, which are for 40-year-olds and up. The mammogram is not sensitive for young people, so we use the ultrasounds. But for example, if someone has a positive family history, depending on their case, at 35, we can even ask a young woman to go for a mammogram. So it's case dependent. You need to have your own routine for screening. So to start your breast screening, you need to look in the mirror naked at the breast. You know which one is your dominant one. Make sure it's still your dominant one. It's not getting smaller. Then you check that there is no rash on your breast. There is no change in anything, like the way the breast looks. That's how it looks. The next thing you do is so there are 2 ways you can do your screening. You can lie down on the floor. We just need a hard surface. So if your bed is hard, you can lie on the bed or just lie on the floor if your mattress is very soft. And then another way to do your screening is by standing. So in the shower, when you are bathing and your hand is very slippery with the soap, that's a great time to do it, because if there is anything, it will pick it up quickly. It will hit your hands. So we use the hands, how we put on powder like this. That's how we'll be doing the breast. So the rib cage has a bone. Your fingers have a bone, 2 hard surfaces. Then we are now going to screen. So if there is anything there, you will feel it. Trust me, if you have a lump, you will feel it. Normally, there should be no lump. Don't hold the breast like this. That's not how to screen. Sometimes when the women hold it like this, that's when they say, oh, it's normal. Normally, you have a lump. We don't hold it like this. So you put your hand, whether you are lying or standing, there. If I'm screening my left breast, my left hand comes to the back of my head to expose the breast. Then you start by screen. So you can either go straight down like this and come back up. Then you have to do it to the whole surface of your breast. So you are pressing your breast tissue down. So we are not pulling the breast, we are rather pressing it towards the chest wall. Or you can go around the breast. So I will go like this and then come around. So that's how you do the screening. Then I come closer to the middle because I started from the outskirts. And then when you reach your nipple, you press it just a little like this. It has to be dry. Unless you are pregnant or you are breastfeeding, then something should come out. Otherwise, your breast should be dry. Nothing should come out. Then you need to go into the armpit to screen. Sometimes there will be some tissue there, the breast tissue I was talking about. If there is nothing there, you shouldn't feel anything. Your lymph node, you don't feel them normally. If you feel something there, but you didn't feel anything here, there is a problem still. So that's how to screen. Inti, mommy, my stress and your screening. Yensa yam baby a debo powder no. Would be mia unufu no. Aka okoko kase no. Inti bibi wo mo a obete. Oko mobi enso aya training no screening wa ono screening a onso behwe se netie sa no nso di besua enti breast cancer ne hia yen ane se mobeba ntem hospital so bi bantem a yetimi esa cancer no problem e wa breast cancer ho ne se etretre inti entina nufu onimu nko a and once a be etre every nufu onimu no ye treat obana and yes ye san yare bium ye try to prolong the life and na bibista ye besa ne frim once a kokram ni be free nufu onimu no akoba bi foforo no cure is out of the question. Espredico baby for target organs obana dream ni kasemu ni brebo na hrawa inti nyoma for way ekwa na say abode no inti eno ne betimi eku oba no sen kokram ne betina nufu ni munku a entimi nku oba no but move ko baby foforo a ekosei sa abode na ekuno unhia unufu se ode betina se unfa unufu no enhome unfa nye bibi serious a enti na treatment no si yeyi nufu ni free ho ne mre so kra na oba no timitina se emfie dudu anyame de ama no because nufu no enye ade a unhia so odi be tina se ahome ni ade enti ne ehuhia ene se obehwehwe nufu onim sanu bibi mpo statia no aba hospital entempa se oba ntema ebi ohwa ye ntwa nufu ni nyina mfiri ho obia ni case ena breast cancer nso enye kokram baako edosun bebre nti obia ni treatment ko a ye de be ma no se oba yeti cancer ni bi ni akohwe se eye type benya inti report ebenya no eno ne de be hwe so treat oba no inti obi oho no be start surgery first and sana yabono chemotherapy ne de fa moja ni mano na ebia ni trinwe tutu ni ade ba owie treatment na trinwe ne beba bibia besa ba back to normal inti obi nso beba ye be start chemotherapy ewie and sana ya ye ni surgery inti obi ane ne de depende on type cra owo uwie treatment na odane survivor ye from survivors se nufuo no ye jebia nufuo no wo ho nti ebetimi asan yare nti still e was yo screening nufuo second one no ono nso wo ho obetimi ayare ti obi wo ho a nufuo tu ni nyina betimi anya cancer na o si e treat si ebetwa cancer na free one na ni mienu nyina ebetwa ni nyina free e depend nti enyase me de wanya cancer nti untimi nya biom wabrabom se nufuo ni ejabi ana second one ne wo ho a ubetimi asan nya cancer no nti screening na wo so bia ye bi so anya cancer da anya bio wo so yo screening to treat breast cancer there are different types of treatments and everyone has their own treatment pattern. So breast cancer is not one disease, it's an umbrella of diseases. So when the woman comes, we do a test to find out, one, is it cancer? And two, what type of cancer is it? Then when we find that out, we now form a treatment pattern. So someone can start with surgery. And there are two types of surgery. We take out the cancer or we take out the whole breast. It depends on the situation. Then someone can also start with chemotherapy. There are a lot of side effects of chemotherapy. Loss of hair, nausea, weakness. But after the treatment, everything goes back. The hair will come back. And so treatment depends on who it is and the type of cancer. So you can't compare to women with breast cancer. And then after treatment, there is what we call survivorship. That's what we call the women. They are now survivors. But if we didn't take out the whole breast, it means the breast left there, it can still get breast cancer. So if you have breast cancer, you've gone through your treatment, you still have to be screening, because if we leave a breast tissue with the place that had the cancer, it can get another cancer, or your second breast can also get cancer. So screening is for everyone, regardless of whatever happens. And then with the treatment, there are different types of treatment, everyone in their type that they go through. So it's time for questions. But before that, I wanted to show a bit about our women with breast cancer in Ghana, our survivors, and a little bit of their stories. It's just one slide. So the first, do you see the cursor? This woman is Auntie Joyce. She is the leader of our Breast Cancer Survivors Association. And we have close to 800 women in the group. She's the president. She's the third person in her family to have breast cancer. So in Ghana, I work with Breast Care International in the Peace and Love hospitals. And then we had a dress campaign where they had makeup, and GTP provided them with the clothes, and we had pictures. So they tell their story that having breast cancer is not like a death sentence for the woman to look a certain way. They are still women. If you see her outside, you can't even tell she has had cancer. You can't. We didn't take out her full breast because she's the third person. She knew, and her sister didn't hide it from her. So she came in early. We started with surgery before the treatment followed. This is Joyce. Auntie Vivian is 14 years after treatment. Joyce is 10 years after treatment. This is her 11th year. So in 2012, it was in October, she heard us. She came very late, and we are happy she's still with us because the breast was very big. We couldn't save her. So we had to take off the breast that had the problem. She dresses up with prosthesis so that when she's coming, she looks like she has both of them. And then this is Rahima. She is 13 years after treatment. And then she now has 2 breasts taken off. She first had one, and now she had the second one. So she doesn't have both of them, but she will dress up and you won't be able to tell. So our time is almost up. This Joyce showing her prosthesis. So if there are any questions, I am done. If it's also too late for a few questions, you can reach out to me or Amma or Efia, and I'll privately answer if that would be okay.
Thank you. Thank you very much, Dr. Abena Adai. Thank you. Nyame Unshaw. Like I said, it's time for question and answer. I think that we have a few minutes.
Okay.
We'll open it for question and answer. So, private users, like she said, no, you can reach out to her, or if Amma, between on a private number, not one answer it privately. So.
Okay, Belinda.
Hello, yeah, that was Belinda, ma'am. I've been with your doctor, 13-year-old, no. The age, no, and my treatment, no, you're more effective, and I'm saying no, son, but you'll be brave.
Okay, so with age, no, it doesn't mean say treatment be effective or not. So with the whole process, no, you follow, your age has no effect on how you respond to your treatment. And there are different types of treatments. To say a drone, you have different types. See, you first one, no, not one respond well, it's Mrs. And na make us say, wuntimi mfa obia en compare ebia obinya diagnosis was say madam for we no use to yentimi so I was me use way. So age no has no effect on how Obani responded to the treatment. We just follow to see cancer cells, no, any treatments, no.
Thank you, Doctor.
Pacham also.
Pachane.
Pacho, better doctor say. The question and it say, and say because I will me who say and I say it say, obi our breastfeed be an when you say when to me breast cancer. Let me say, any our ya ye kunu ye tini di ni funima wo no eno so bebo ama cancer ni ntimi nya bia na.
Okay, so first correction, and yes, obi breastfeed ya onya cancer, a reduce or risk. Inti obi wa wa 10 obe breastfeed yo munyina so still obetimi enya cancer no. A protective moban but really go out obia betimi enya bi. Nyoma me bobo so nyina emfa ho ubetimi still enya cancer no. Ena breastfeeding no eye akola de nko a inti se uni ukunu breastfeed wa emfa cancer no hu ba bia emboa eno nso a emfa cancer no embrel inti there is no link with ukunu breastfeeding eye akola de nko a ne kan.
Okay, thank you, Pacho. I think it's Sister Gertrude.
Yeah, me Pacho, my question no baby I will say ubetu check here what's your armpit no. So we will be out tenya say we an armpit will take utuminya what's pompon in the motor. Minim say be alarms no it's a feel a painful and I say it's different from say be when you're in pompon motor and obi so out tenya some pompon no. We are risk of getting breast cancer now.
Okay, so two different things, and make us most of the time no breast cancer and any pain and and nothing trains to pain to mean something for breast cancer. Most of the symptoms no pain bianca and component misisi wa motum infection na deba. That is different. And no na ya ebi mu wo ho amuntimi kran kan mo nsane nto ho because pompone wo ho. So sometimes no deodorant ana bibia wo use na irritate you. Inti ye advice say women nin change deodorant ana se wo ofia na ebi mu wo beka si jai bibia na isu anka twade kakra na ye hu se bia bibi wo nya wo using na how. So there is no link. Problem e wo ho ne say wo no e be ya odin se obehu se bibi e den wo ho a wo e wo so hwe se eye me de na tai bi bana component system no ana se bibi wo nufo ni munti na pompa ba mamotuom say. So wo na wase wadwen ba unufu ne so screening so ye because bibi foforo san wo wamotuom ho a e wase wo distinguish say eno na ha mi say potin ye na say minim say what try change with deodorant ni ade to see say pompon be jaye ana e be reduce but bibi wo ho etisa pompon ni wo ho ena breast cancer no start move e kwhye lymph node nim no and also wo two different things into pompon there you need to be more aware to try and see say maybe there no pompon na screening there is a problem so I need to check it.
Maybe I'm not watching and said that my background is into.
Oh, sorry, my Pacho, go ahead.
I feel the one who said that hobby, sir.
Yeah.
Yes. I mean, sure, Dr. Abina, why are dear pa? Let me person me boy Auntie Gertrude, Sister Gertrude. Not Nancy, your research be said, yen deodorant and aluminium be woman in the cause breast cancer normal. Into shoppers for I started and as other companies that start on my year deodorant aluminium very expensive. Into so shoppers are bon say no so nipa be 3 na chirem we dwumem won say we be a deodorant section one but very expensive ni nyina aluminium nim omo say no Ebwama obi a unya cancer research bi omo which we don't know, but you try say you better be nebi aboa. Doctor,
okay, but there is no cause. So in the end, you say a cause. So it be irritating, but the cause we don't know a cause yet.
Okay.
Yes, we don't know a cause.
Yeah, me try na me reading na me who say na me be nimu a say I don't know say they work.
Yes, but not that a be cause breast cancer.
Okay. Wo screening na manage ho pa say na wo say o chere say ya man ko ano be ma bi any line so nti so wo she shower se na wo nsa ho ye wet na wo ya e bede na se nsuo wo ma nsuo na nsuo wo breast ni mu na wo she shower na se na be na watimi ehu ana se na de wo be separately after
Okay. So there are two ways for that. Most of the time, no say pressing upon na nsuo wo ma eba straight say into unless maybe you won't mean notice it there, then out of the shower and you can just do the last parts or you repeat the whole thing, it doesn't matter. But other than that, no, when there's liquid na umia nipona, most of the time no, it comes out with some force in tinka. There are also times a liquid may be a green, a bit different color, reddish, sometimes to a blood and a very red. So the liquid can be any color. It's not just that it's colorless and I'll be bisa. Bit me any color.
Okay, thank you.
Okay, Pacho, Sister Fia.
Me Pacho, where the one me de kan ho kakra. We no braka gin na okaye no. A criteria ni obi a na wo kwa ye be sa test na ma. Nti se bia wo obi wo abusua mu a onya bi at an early stage automatically no will qualify for it, but it has to be blood related, like so we the long distance me cousin me say, but unuya ana say bibi sa wo abusua no wanya bi ntemu a eno no qualify o ma okoye black gene test no check say won so wo bia na wo bia betimi take preventative say bia wo betimi a double mastectomy to prevent you from getting in a lifetime no. And screening also are now can we no two positions I na eboa wugina ho ya na wasen ada ho aye because lamp ni bi wo ho no a wugina ho a won fili but wo da ho a wo fili ebi won so a wo da ho a won fili but wugina ho a wo fili nti no ye better say wo be ye no both positions no. And you really have to advocate for yourself. Sometimes doctors no kona ko hu omo na wo ye young se bia wo hu bibi nti no omo nye ya wo ye younger, sometimes they feel reluctant to order anything for you nti e was a wo advocate for who say me pese me koye we say ba still on nye ma wa another doctor na kono omo nye no really out say enye cancer, and at least no who say you followed up, because some of the doctors are very quick to say we are young nti I mean, you don't need that. It's not breast cancer, but said your kind 13 years of cry, 18 years, young to me advocacy for yourself when it comes to data. And that treatment and so I know all can. So I said, you'll be to make us so mean you are when you be saying the treating. A bit me crying the same type of cancer, but we stage, natural with treatment. And even though it might be the same type of cancer, maybe I'll be also when you be. Will stage very different, or not the stage very different. The stage is also considered when it comes to treatment. Will be any now what the same type of interest with treatment, a be the same thing. And mwaka krana na me deboa your kind.
That's it, sisters. Pacho, me so because or question.
Pacho me.
Okay, Pacho kasa.
Nothing Musane say a dear belly and a cause because we would be a when your cancer. Ya ye free ni motuum. A year and then Sabako ayaka clacka. We nipper to be a before more like a clacka. This almost a cancer no you on what woman and affect woman time and like a cracker. A dear thing a course of that please.
Okay. Lymph node na me kan no. So nipa body system no. Yewo moja circulation. And yewo lymph node nso circulation. Lymph node no. Ewo the whole body. Inti yakwaya surgery no. Common etimisi say ebia lymph node ne block it. Then pass it. So if cancer ni be called lymph node ni ewo ho amoto ho na ye lymph node na affected no. So that cancer then spread it. We don't want to spread. Inti the lymph node no enye juma te sesenia first no na ye no. Inti ninsa na ye kese no is because lymph node system no are affected. Into drainage, lymph node na juma so be drainy the liquid no. Into because system na ya affected no enye juma to send ye no first no. Enti as ninsane started kesiye. So more developed world no, there is even more access to extra what we call complementary treatment. For example, even with chemo, your cold therapy, which is common here, if being nifie, you try see your best jai, your best stop say you need to do during chemo. Your test be a yetimi ye, near kase ebia okra here chemo, way here, and also a developed world has say. Another thing, yes, sleeve no. Inti obibet me a share sleeve no. Na sleeve no ma pressure one insano. Inti it reduces swelling from the effect of the lymph node na a blocking no. Ebi wa hokra nyasi ye ni surgery se kokram ne wo ho na se emove ko na motuom ho ne anya ho hwe ye nye surgery nkra etimi cause blockage no. Na lymph node no enye dwuma sane etimi ye nti ne nsa no be start e kese. Into most of the time, but what side na cancer ne wono. So it's a block of the lymphatic system. There is a lot of research going on how to research what they say more yes and you bit me stop or help it. But for now, no compressive hand is one of the things that it has is very common for people to be wearing that to help with lymph node drainage no na reduces swelling no inti nuntina swelling ne wo.
Okay, I think say yemre no aso
Maybe
Maneli.
I may a question. Let me be say what age is the best age for the children to have their menstrual period? But
Okay.
now I can say so we are in Tamwa and yet you are tricks at the age of 55. Into age prime pa na yet the best.
Okay, so yen trese ebia o bagela you say to delay the menses yen kanesa. First of all, and your man na me can say enya fact say way to obia obenya cancer no. It's just increasing the risk. Age to start menses no there. Please don't try and tamper with it. We only advise for healthy lifestyle, even in the children. Like was active and was obese nearly. But age or best starting there, nature and take its course. Send your starting and there is no particular age. Make us say momuna when you na mubehu. Obi oho best starting before 11, maybe 9 years. But so or getting into menopause at 50 years. The exposure no be same as obi or starting later than 11, no, but maybe or no could 55. So it's until oba no bedru ni menopause no na wadwendwen ahwe na chi say minya long exposure anasimenya. So we can advocate say ye bibi na akola ne chance and was started there be don't try and do anything there. It's just healthy lifestyle and risk factors nina enye fact obi betimi atike boxes nina so wonya cancer obi nso ho healthy lifestyle. We all know of omo athletes ne you mutimi nya cancer. So it's not, there is also lack or chance in there. So we leave everything to nature. We just say it because you should know, say, me long exposure na I should be more concerned with my screening.
Okay. Yeah. Didn't be and say, once you chroma phone call and no more than 10 time cry na ehudodo.
Okay. And no, it's not a hankwa around no say age need to conform. I know what you are saying, but the world is changing. See, that's not the only thing that is and Kolani need
yeah.
Yeah.
That's why.
Okay, doctor. Yeah, say I think say you're married to know. Yeah, the questions no be see them. I said you did kind. So what any question be went to me and miss she's willing say or contacting a private there or be answer mo. You know, you can obey to me and true I'm Maria Fe. And I say if maybe a bit to me then contact information I'm anything no say you on your phone to the best I can say doctor that was Nyankopon unhya wo no fiefo nyina na onim de no de ama na ode yewa dwuma no on mo na minim said this is not the first and last. You better invite to be in due time. The source say Safra Yapra. It was such a privilege, near educative man. Say and we've learned from it. Said the antipath kind me screening no kana minim, but so it's demonstrated, you know. It's very educative. I'm saying na enye be a film. Tino that was say. Ya da nyina ho so say aja ya daje nearby. Minim say ne wanye bibi enfim ne wonya bibi efrim a odi be boa obi. And intien chen ho no ye be frɛ yes sister Becky. But baby I want to say ya Mr. me too self na pon ye unfa dwumadi nhye nyame nsa say nyame ma yenim de na said what kind no say ade betim da prevent most a healthy lifestyle. Intimate maintaining healthy lifestyle. Looks like it's a healthy lifestyle. It's not only this last 6 years you say strokes so you live a healthy lifestyle and so to me decrease your chance. It's not reach me say a very important in our life. It's me so say senya me say obe my ho ahoden nim de na yetimi live a healthy lifestyle said e be yare free abrabo. Na wosha your sister so my no upon you. It's me so sister Becky.
I'm Johnny see that the name on fire. When I'm too for anyway, that was it. When India, would the my sister. Now one can't share no good to Hanamo. What 1 year about the share. That was it. Away in now, you be share mine so. Yes, sir, I was saying India, I used to stay in a shade. A bit to me to one more. Na near I was here, said the bear. Ya really. Ebi wo ye busua mu kura na ye betimi aye said ye be ya ye nya bi e still say my sa ho de no my intimi discipline ye ho e wo ye didie mu ya ko fa ya re di na ye ho ye no kwa akodan ye still say boy ye ho ban ade a chi a de na se no that was so it's ye o do ba yesu kristo di amen.
Amen. Sabeki nyame unsha. Yankopon unsha yina. Nyame ma na watwe ebetwe na ebese hia a week today. Nti ma ye ho mispa. Sedin titim. Yehowa enhwem.
Amen.
You